All right, well, good evening, everyone. Thank you for joining us. And we're going to talk about shockwave therapy in our canine and feline patients. And she already talked about me, so we'll move on. What's our agenda tonight? So our agenda is we're going to talk about what shock therapy is and what it is not. We're going to talk about how it works in our patients, indications. I'm going to give you some scientific evidence, and we're going to go over some case examples. And then we'll discuss treatment protocols and how it can benefit you and your patients. So the one thing to remember is that a shock wave has nothing to do with an electrical. And that's really important for our pet parents, because a lot of times they hear shock wave and they immediately think electric shock. It is not that. So what is a shock wave then? So a shock wave is basically a high energy sound wave. And what you can see it can be produced by either a supersonic aircraft. It can by explosions and by gunshots, but I like to use the example of lightning and thunder. So lightning is an electrical spark that changes the pressure of the air around it, and that leads to the sound thunder that you hear. So if you've ever been woken up in the middle of the night with one of those beautiful thunderstorms in Florida that we used to get, and you hear the shakes your house or your windows rattle, that's the sound energy being deposited into your house. So this is going to be an exaggerated representation of how the sound energy is deposited into an object. So this is a pool with an electrical impulse is going to go off, and these are 3 water balloons, and then we're going to see how it works. You can see the impulse, and as the sound wave travels through the water, it gets absorbed by the balloons and causes them to, in other words, shake. What is shock? So we know what shock wave is. It's a high energy sound wave, but what isn't it? Well, it's not a radial pressure wave. This is more like what you would see a radial pressure wave. We don't see these very commonly in our companion animal medicine, but it's sometimes marketed as a shock wave, but it is not a shock wave. It's actually a mechanical pressure wave that literally just pushes the skin, very similar to like a Theragun or the facial guns that you'll see on Amazon. It's a mechanical energy, not sound, and it's an unfocused energy. It has a proven lower efficacy and a much lower peak pressure with a maximum depth of less than 5 millimeters. Now there's also laser therapy, and obviously shockwave is not laser therapy. Laser therapy is light energy. And with this, you're going to get a lower penetration depth because light doesn't travel very far in water, less energy to the treatment area. Some of that light energy is lost in the tissues as heat, and you commonly need a lot more treatments more frequently. So the example I like to give between laser and shockwave is that light, the body is predominantly made of water. And so light does not travel very far in water. It's very shallow. As soon as it hits the water, it kind of dissipates and radiates out. As where with dolphins and whales, they use echolocation in order to communicate. So sound waves travel much deeper and much farther in water than light does. And this is why shockwave can be used for many different indications that laser is not good for. All right, so this is the physics. So we're going to get into a little bit of the physics of the shockwave. It's an extremely rapid, high energy sound wave at impulse or a small controlled focused explosion. Okay, they're all characterized by an extremely rapid rise time or pressure front, which you can see here in the front. And then it's going to always be a slight negative pressure dip that leads to a cavitation. And all high energy sound waves have these physical characteristics. So now we're going to talk a little bit more about focusing the shockwave energy. So the energy is deposited in the treated tissues is primarily the result of a reflected shockwave. And this is geometrically focused. Think of it like some of that energy piled up into a specific location of which you can determine by the shape of the reflector inside the trode. Almost all the energy is deposited into what they call a focal volume, or oftentimes called a focal area. And that focal area is scientifically defined as the volume where energy is deposited at a level 6 decibels below the peak energy. And in this graph, you can see where the peak energy And if you go down this circular area, that is the focal volume. And that is that's how they come to figure out what that is. Okay, now we know what a shock wave is. We know what a shock wave is not. But there are different ways of generating a shock wave. And the three most common ways, number one is the electrohydraulic. And this is more like lightning with a focused thunder, would be a great way to describe that. And as you can see, it has a very large focal area, a high peak pressure, rise time is nanoseconds, and it is a true shock wave at all energy settings. Then you have electromagnetic, and the best analogy for this is a loudspeaker. What happens is you apply a voltage to an electromagnetic coil that vibrates and changes the pressure of the fluid around it, and therefore creates the shock waves. And as you can see, it has a much lower peak pressure. Rise time is in microseconds versus nanoseconds. And you only are getting a true shock wave at the highest energy setting. And as you can see, it's a much smaller focal area. And this is what would be good for lithotripsy, which would be breaking down kidney stones. Thirdly, we have piezoelectric. And this creates sound wave by focused vibrating crystals. And again, this has an even lower peak pressure. Again, rise time is in microseconds, not nanoseconds. You're getting a true shock wave at only the highest energy settings, and it's even a smaller focal area, which is again good for lithotripsy. And then this is the last time we'll bring this up, which is the radial pressure wave. Again, it's more like a pneumatic jackhammer, but it can be sometimes marketed as a shockwave device, but it is not. It has very little of any peak pressure, rise times in milliseconds, and it does not produce a shockwave at any setting. So now let's compare the focal zones, because again, this is important. So you can see that with the electrohydraulic, which we see in the extrode, a very, very large volume, 140,000 millimeters cubed. When you get to electromagnetic, you're at 61 millimeters cubed, and with piezoelectric, you're getting 1,400 millimeters cubed. A huge difference in the focal volume between how the sound wave is being generated. So this is an example of the electrohydraulic. As you can see, you get the spark gap. It's going to change the pressure. You're going to get your initial wave, and then your focal volume, and then your reflected wave. And then this is going to show you how electromagnetic, how it generates. And you can see how as it generates the sound wave, it's a much smaller focal area. Same thing with the piezoelectric. As the sound wave comes in, it's this very, very small focal area. Oh, now I know you're probably thinking, why is this important? Why do we care about the focal zone and the focal area and how large it is? Well, the reason why is it helps to determine our treatment protocols as to how many pulses are required per treatment, how frequently those treatments are need to be given, and how many total treatments we need. And so, as you can see, piezoelectric and electrohydraulic are the two most common generators of sound waves in companion animal medicine. And as you can see, electrohydraulic requires far fewer, only 500 to 1,000 pulses per treatment. And that's going to be dependent on the size of your patient and what you're treating. Total number of treatments is usually 1 to 3 for all indications. And the frequency of treatment is every 2 weeks for a total of 3 treatments. Now, this is great, but what does it do to help our patient? What is it actually doing in the body? Because that's the important part. We know the science behind it now, and what is it doing? So basically, it's a high energy sound wave. And what happens is the energy gets deposited in an area of density change. So as it travels through the body from the point of which it enters, it's going to get deposited where there's a density change. And this is going to be bone, tendon, ligament. And microscopically, it's getting deposited into the cells, the surface of the cells. It's applying a compression and tensile stress that mechanically stimulates the cells. And this process is called mechanotransduction. So now we need to see, okay, now we know that it's stressing the cells, but what does that cause the cells to do? How does that help healing? How does it help our patients? Well, what it does is it helps, the physical shock wave is a physical stimulus to the cells that causes them to release their cytokines and growth factors, which are all important in healing. And so I tend to break this down into 4 categories. One, they increase blood flow through neovascularization, vasodilation, and endothelial cell proliferation. Secondly, can stimulate cellular bone production with the release of BMP, modulates pain and inflammation through the release of things such as nitrous oxide, and it can also improve the quality of tendon and ligament healing. And so this is just another visual for those of you who are visual learners, so that you can kind of see a different way of looking at what the shockwave is actually doing to the cells in the body that lead to the healing. What else does shockwave do? There are other medical effects. One is that in vitro, it has been shown to disrupt biofilm, that slimy covering that bacteria love to shield themselves with so that our antibiotics don't work so well. And so what we found is that shockwave can break down this biofilm shield and allow our antibiotics to actually work better, making them more effective. And this can be great with infected wounds and infected hardware, such as TPLO plates. Another thing that we've found is that shockwave therapy can decrease cartilage degradation, inhibit the increase of inflammatory enzymes, and remodel subchondral bone. And I will be talking a little bit later about a couple of studies. One was done in rats and one was done in human knees for osteoarthritis, and we'll get to that in a little bit. The other thing that it does is it can induce a temporary analgesic effect. This is well documented in equine, but we can also see that in our companion animals as well. So let's get on to how do we use shockwave in our patients? Well, we use it to treat 4 different main indications is how we group things. First is tendon, ligament, and muscle, bone healing, osteoarthritis and chronic pain, and then wounds and lick granulomas. So now what I'm going to do is we're going to go through each one of these indications, talk about them a little bit more in depth, go into some of the research behind each one to show the efficacy of sound wave therapy, electrohydraulic sound wave therapy, and then go over a couple of cases. So first thing we're going to talk about is tendon, ligament, and muscle healing. So it is a great alternative to surgery in difficult cases where either conservative treatment fails or the owners are unable to or do not want to proceed with surgery. It is also great treatment in conjunction with a rehabilitation program. And different types of things is any kind of shoulder tendinopathy, Achilles, partial cruciate tears, fibrotic myopathy, iliopsoas injuries, just to name a few. And what they've also found with tendons and ligaments is this is the indication that put shockwave therapy on the map in equine. They've been using it for a couple of decades now for equine injuries. And what they found, they did a study where they had horses that had suspensory ligaments, and they allowed some to heal naturally, and some were used shockwave. And what they found is by using ultrasound is they found that the suspensory ligaments that had been treated with shockwave therapy not only healed faster, but they healed in a linear pattern. It actually helped to realign the fibers of that ligament so that it had a better healing, and therefore made the horse more immune to re-injury of that suspensory ligament. So, well, let's look at some scientific evidence. This was a study that was done over 15 years ago. That was done in 2012, and it was done at the Georgia Veterinary Specialists. And basically, it was one of the first studies ever published in canine patients, and it looked at patellar ligament desmitis. And what they did is they radiographed these patients at preoperatively, and then 4, 6, and 8 weeks, and 8 weeks of after post-surgery. And the dogs were treated with shockwave treatment at 4 weeks and 6 weeks. And what they found when they measured the patellar ligament thickness is that the distal third of the ligament is what they chose to measure. And what they found is that there was a significant difference in decrease in thickness at both 6 weeks and 8 weeks post-op in the shockwave treated group when compared to the control group. And this image, they are kind of dark, but they show the different levels of the patellar ligament swelling. And then this was a study done on shoulder lameness. It was a retrospective study, and it was done at I always mention this because it was done at Tufts University by Dr. Mike Kovaleski, and he's the one who taught Dr. Jen Bertucci at Ohio State when she was there. And it's a retrospective study of shoulder lameness in in dogs, and all of the dogs were diagnosed with either a biceps tendinopathy, a medial shoulder instability, or a supraspinatus tendinopathy. And the median duration that each one of these dogs has had was a 9-month of lameness. And so what happened is the dogs were treated with treated 3 times with shockwave therapy, and they each received 750 pulses per treatment at energy level 4, and these treatments were given 3 to 4 weeks apart. Now, it's really important that we know that there were no complications following treatment, and we find that in all of our research, that there's no complications, nothing going on. What they found is that all 9 dogs, it's 100%, had improved or resolved lameness 3 to 4 weeks after their last treatment. They also did a long-term telephone follow-up of a year to 2 years, and 64% of the dogs, 7 out of the 11, were considered by their owners to either be better or normal. So you also have a very long time that the treatment actually lasts. This is JJ, and JJ is an Australian Shepherd. He was diagnosed with a full CCL tear to his left hind leg in October of 2021. When he presented, he had a lameness of 3 out of 5 on his left rear, and he had been on pain medication at presentation. His treatment protocol is 3 treatments. Each were 2 weeks apart, energy level 6, and he got 1,000 pulses per treatment. After 1 treatment, he was already down to a 2 out of 5 lameness at a 2-week recheck. After the second treatment, there was barely any limping anymore at that 2-week check. And after the third treatment, there was no lameness noted. And so this is a video of JJ 4 months after his 3rd shockwave treatment. And remember, JJ had a full tear of his left CCL, not a partial. And that's pretty darn, he's looking good there. The next indication we're going to talk about is bone healing. And so shockwave therapy can be used for any kind of fracture or osteotomy healing. It is a great adjunct or alternative to surgery to accelerate or improve quality of healing. It can be used to treat delayed and non-union fractures, as well as an alternative to surgical revision. And it also is fabulous in conjunction with surgical repair, such as TPLOs. I also love it for the management of your digital metacarpal metatarsal fractures, those that would normally be medically managed. You wouldn't do surgery where you splint them, rest them. As we all know, those can take a very long time to heal. And what we have found is that using shockwave can increase how quickly they heal. So this is a study that was done by Dr. Keeves at Colorado State University in 2015. And there was a 2-part study. So this is the first part. In the first part of the study, she had 13 stifles. She put 7 in the sham group and 6 in the shockwave treated group. She took radiographs at week 0, 4, 6, 8, and 10. And then she had a radiologist review them on a 5-point and a 10-point pain scale. And what she found is that in phase 1, the healing scores at all times, and you can see the red line is the shockwave therapy group. At all time frames, there was more advanced healing for the shockwave treated group versus the sham group. At week 4, that difference was statistically significant. And at 8 weeks, they found that all of the shockwave treated patients had completely healed osteotomy sites, where less than half of the control group had theirs completely healed. And that was part 1 of the study. And then here's a picture of the radiograph, one of the radiographs. So you can see the sham group after 6 weeks post-op. You can still see that nice osteotomy slice going on. In the shockwave therapy group, 6 weeks post, you can see there's a lot more advanced healing going on. So then this was part 2. So in part 2 of her study, she had a lot more. She had a total of 44 patients. 54 stifles were enrolled. And this time she took radiographs only at 8 weeks post. And they were evaluated by 3 blinded radiologists, again, using a 5-point and 10-point scale for pain. No major complications were observed, and all the osteotomies did eventually heal. And what she found is that at 8 weeks, the median healing score for the shockwave treated group was significantly higher than the untreated group. And I'd like to note that Dr. Doerr was the clinician on study for this, and this is Dr. Doerr. And if there's any guesses as to what the patient is, it's a grizzly bear. That's Marley. Now, this is a study about that was done by Dr. Marty Drum at the University of Tennessee. And he was presented with 3 dogs that had a greater than a 15-week delayed union at their TPLO site. And you can see the x-ray over here, definitely not much killing going on. And what he did is he treated each of these dogs with a single pulse vet treatment, a single shockwave treatment, 750 pulses with a 5mm trove, and he used energy level 3. Then he brought the dogs back 4 weeks later, and he re-x-rayed them. And what he found is that they had less pain at the osteotomy site, better weight bearing, and lameness, and that had all significantly improved at the 4-week recheck for all 3 dogs. And you can see the x-ray on the bottom, how much healing has occurred in that period of time. Now we have the case of Butters, and this is going back to what I was talking about, how shockwave can really help these metatarsal, metacarpal digital fractures that we would normally just splint. So when Butters came in, he's 15-year-old male neuter Chihuahua, and what they did is they gave him 1 shockwave treatment and they put him in a splint. Obviously told them to restrict activity, and they brought him back in 4, and this is him getting, he's not sedated, he's loving it. So what they did is at 1 month, they brought him back and they rechecked the rads. You can see that there is some callus forming around that injury. So what they did is they gave him another shockwave treatment, but this time they put him in a soft padded bandage. They had him come back another month and recheck rads in 2 more months. And here you can see that it's well healed. And so there was no further treatment needed. The next indication that we're going to talk about is osteoarthritis. And so it helps to control pain and inflammation, but it also helps to manage the disease. And studies have shown that shockwave is able to slow the progression of osteoarthritis. And we will talk about that. And it's always, as we know, nothing cures this disease. It has to be a part of a multimodal approach. As we know, this is the terrible cycle, the nasty cycle of osteoarthritis, where you have your instability, leads to synovitis, leads to the overproduction of macrophages and synoviocytes. And those beautiful macrophages then release all of these pro-inflammatory cytokines, which then break down the cartilage, and that leads to chronic pain and decreased quality of life. And it goes on and on from there. So I know you're wondering, how does shockwave help this? Well, shockwave helps by this. What happened is that shockwave actually decreases and downregulates the pro-inflammatory cytokines, such as osteocalcin, COMP, MMP, and TNF. And at the same time, shockwave increases the good enzymes like VEGF and BMP2 within the joint. And so this is how shockwave actually slows the progression of the disease and prevents cartilage damage from worsening. Let's look at some scientific evidence. And this is what I talked about earlier about the study with the rats. So this study was done by Wang in Taiwan in 2011. And what he did is he had 72 rats and he divided them into 3 groups. One was a control group. One group had surgically transected ACLs, and one group had surgically transected ACLs and 1 treatment of shockwave 1 week post-op. And what he did is at 12 weeks post-op, all of the rats were harvested and histopath was performed. And what he found is that the results showed that rats that received the single shockwave treatment had significantly less osteoarthritis, including decreased collagen degradation, as where shockwave treated knees showed decreased COMP and osteocalcin, as well as decreased chondrocyte apoptosis, when compared to the transected ACL rats that did not receive the shockwave. So that was fabulous. And then in another study. This one was done in human knees, and this was done in January of 2022. And basically what happened is they had 3 groups of people. And what they wanted to see is which was better at helping with pain and enzyme levels and function scores, and daily NSAIDs for 3 weeks, intraocular hyaluronic acid injections, 3 of those, or 3 shockwave treatments given 2 weeks apart. And so what they did is they measured functional scores, enzyme levels, radiographs, and MRI. And so basically what they found was that the results showed that the shockwave showed superior pain control over the NSAIDs and the hyaluronic acid. The functional scores improved within 1 month after shockwave treatment, and they lasted up to a year. And bone density increased during shockwave treatment. Enzyme levels did not increase with shockwave treatment. And then here is a graph of it. So this is for the pain, and you can see the green is the shockwave treatment. And you can see that at all points, pain scores are less for the shockwave treated versus the NSAID and the hyaluronic acid. And then there's also a canine model of osteoarthritis going on or going to start soon at Colorado State. So now this is a study that was done on shockwave treatment for our elbow osteoarthritis. This was done by Dr. Marty Drum at Tennessee. It was a small study. There were 15 dogs. They were all radiographically confirmed to have elbow osteoarthritis. And evaluation of subjective gait at a walk and a trot, comfortable range of motion, and ground reactive forces at a trot were used as outcome measures. And you can see at the top with the peak and break force, peak vertical force, and vertical impulse. The dogs were evaluated at days 0, 14, and 28. And the improvement in ground reaction forces was like that what we would expect of strong NSAIDs. Patients showed increase in ground reaction forces and in weight bearing with the shockwave therapy. Dogs that were initially in the sham group and didn't have the same type of reaction, they were then given the same shockwave protocol, and they showed the same amount of improvement. So this is the case of Butters. Of Brutus. Brutus is a 15-year-old male neutered Persian, and he had progressive left hind limb weakness, moderate to severe osteoarthritis of his left hip, and he was given 2 treatments 2 weeks apart at energy level 4 for 500 pulses. And when he came in, he had trouble jumping up on the bed and getting in and out of the litter box. And he did great for the treatment, unsedated. His gait and jumping ability improved post-treatment. And he was treated in August, and he has not had to be retreated. And we should have a video here. I had a hard time getting it to play last time. Like I said, there's no video. So next, we're going to talk about chronic pain. Which can be kind of lumped in with chronic with osteoarthritis. But in chronic pain, shockwave has been successful for the treatment of chronic pain, especially that in the lower back. It is not, the only thing is that we say that it's good for non-neurologic back pain because shockwave has no effect on the nerves. Conditions such as degenerative myelopathy will not be affected by shockwave treatment. So it does really well with chronic pain and inflammation along the back, but not anything that's neurologic. And so here's some scientific evidence for chronic pain. And so this was a pilot study that was done in California by Dr. Kim. It was a retrospective study. There were 38 dogs and 2 cats, and they all had either lower back pain or cauda equina syndrome. 34 of the patients received a single shockwave treatment to the lumbosacral area. 6 patients required a second treatment. And again, it's very important to understand that there were no adverse effects that were reported due to any of the treatments. And as you can see in clinical review, 87.5% had a positive response, 77% showed improvement within 1 treatment, and the median duration of improvement was 13.6 months. So we're saying you can give 1 to 2 treatments of shockwave in these patients, and they won't need another treatment for up to 13 months or so. 80% sustained improvement. And when owners were asked, because again, this is really important, owners, almost 81% of owners were satisfied, and almost 88% of owners would choose to do shockwave therapy again. So then this was a study that was done by Katie Barnes at LSU. And what she was doing is she did a shockwave therapy to show that it improved short-term limb use after TPLO surgery. And so this was a randomized prospective study with 16 dogs in two groups. First group received 2 shockwave treatments, one immediately post-op, and then one 2 weeks later when they came into the sutures or staples removed. And then group 2 did not receive shockwave treatment. And what she found is that the peak vertical force and the vertical impulse were higher at weeks 2 and 8 after surgery in the shockwave treated dogs. And let's see here. And then so here you can see that with the shockwave treated dogs, you can see it 2 weeks and 8 weeks, the vertical force was much better. And same thing here with vertical impulse. And we think to ourselves, well, why is that important? It's important in the post-op period for the owner and for patient restrictions, because it allows the patient to begin rehab earlier, as well it protects the other cruciate ligament that we're worried about tearing now. Obviously, if the patient can bear weight after surgery sooner, then it won't be putting as much weight on that opposite limb. So anything that helps us protect that opposite limb is fabulous. And then the last indication that we're going to go over is going to be wounds. And so shockwave therapy is really good for wounds, any wound that heals by second intention. That could be burns, degloving injuries, lick granulomas, anything like that. And so this was a lick granuloma that had a 1-year duration. This dog had this for a year. You can see here on the left, he's got that nice open wound. And then he was given shockwave treatments twice, 2 weeks apart. And as you can see down here, complete resolution. But it does help with granulomas. In review, the indications are tendon, ligament, muscle, bone healing, osteoarthritis and chronic pain, and superficial wounds and lick granulomas. So now we need to talk about where are we heading with this. So Ohio State University actually just finished in December of 2024 a large prospective study that was being done by Dr. Keeves on canine patients with lumbosacral disease. And so we can't really talk about that yet because it hasn't been published, but results are looking really good. At CSU, they were also doing a large study on canine osteoarthritis following PPLO and partial cruciate treatments. And in equine patients, there are 2 different studies going on. One is using shockwave to treat sarcoids, and the other is to treat exercise-induced hemorrhagic bleeders. And so other things that are going on with shockwave treatment. On the human side, currently electrohydraulic shockwave is currently FDA approved for the treatment of tennis elbow, plantar fasciitis, and diabetic ulcers. And other things that they're looking into is prostatitis, erectile dysfunction, wound healing and scar modulation, as well as even spinal cord injuries. And so to your right, we have these 3 images, and these are of rats. And what they did is the top in A is normal heart muscle in a rat. In B and C, there was a ligated cardiac artery. In B, shockwave. They shockwave this cardiac muscle after the ligation, and you can see how beautiful that looks. All very similar to normal. And there's a lot less problems with perfusion. C did not get any shockwave. And you can see how it's not aligned properly, and there's a lot more perfusion problems. So they're starting to look at using electrohydraulic shockwave in a lot other fun, interesting things. So now we're going to talk about treatment preparation. What do we do to treat our patients? And so electrohydraulic shockwave has been used in the past. And in the past, it was deemed uncomfortable and required sedation in many cases prior to treatment. But what we've done is with the release of the new expanded focus extrode, and that's what I was talking about, the larger focal area, this allows for sedation-free treatment in most pets. And so the other good thing is that ultrasound, shockwave therapy is similar to ultrasound. It sounds just higher energy. You're going to need to make good contact with the area, and you can either shave the fur or you can use alcohol to wet the fur, and then you would separate the fur and get down to the skin. Then you would apply ultrasound gel to the skin as well as the trode for optimal sound wave transmission. And this is Unusual design, you can see it's not stated. And so I know people are asking, well, how long do these treatments take? I was like, so the treatment protocol, you want to move the trode around in a 3D motion. You want to go medial, lateral, cranial, and you want to go a little bit above the injured area and a little below to get a lot of that healthy tissue involved. Usually the treatments are between 2 to 4 minutes, and there's no risk of damage. You can't harm the cells. There's no cell damage. You don't have to worry about burning the patients. If you hold the trode in one spot, nothing bad happens. We just want you to move it around to get optimal healing. So use it in small animal practice. All right, so treatment follow-up. So basically what will happen is one of two things usually happen. They either have an analgesic effect immediately that lasts 2 to 3 days. And in this respect, we need to make sure that we tell our pet owners, hey, your pet might feel really great, but we still need to restrict their activity until they're 100% healed. Occasionally, there can be increased discomfort that can last 1 to 2 days. And so in this regard, you can use your NSAIDs, you can use pain medication during this time frame. And basically, we say to evaluate every 2 weeks and retreat as necessary. But most of the indications that I've talked about require 1 to 3 treatments, and that's it. And we do say treatment should not be repeated until at least 7 days after the first treatment. Case selection. There's no minimum or maximum age, so it is safe to use on puppies and kittens and over growth plates. The difference is that with bone, whether it be a fracture or a TPLO, you want to use the shockwave immediately. When it comes to acute soft tissue injuries, we're talking the tendon, ligament, muscle, you want to wait 7 to 10 days. Now, a lot of people ask me, why is that? Well, the reason why is because whenever you sprain your ankle, for instance, your body is going to immediately try to heal itself. And so this might be a place where you could potentially use your laser in that acute phase. I'm like, but then what happens is that 7 to 10 days, the body's natural healing process starts to kind of taper off. I'm like, but as we know, tendons and ligaments don't heal that quickly because they don't have a very good blood supply of their own. So that's where shockwave therapy comes in, because now you're going to use that mechanical stimulus of that shockwave, and you're going to stimulate these cells back into their healing phase again. And that's where it comes into play really well. And like we said, we don't ever want to use the shockwave directly over an unstable disc or a spinal cord. You don't want to use it directly over the spinal cord. If you're going to use it with IVDD, then you want to use it in a neurologically stable patient. And you also want to avoid going over malignant tumors. And the reason why is because obviously you are increasing blood flow. We don't want to do that. But with that said, if you have a patient that had, say, a mast cell tumor on his shoulder and you wanted to pulse vet his spondylosis or his stifle or his hock, you're more than welcome to do that. That won't cause any problems. We say that you shouldn't use it in malignancy. The only exception would be in palliative care. If a pet is in needs hospice care for pain, say if they had an osteosarcoma, during the hospice care for pain, then it would be okay to use, because obviously you're trying to help them the best you can in their final days. So now this is going to be a final example, and this is interesting. This was given to us by Dr. Pam Nichols out of Utah. And this is an 18-month-old male German Shepherd, and he had progressive multi-limb lameness. He was diagnosed with panosteitis after radiographs, and he was put on pain medications. But the pain medications were not helping him. So he was given a treatment protocol, 2 treatments of shockwave therapy, 2 weeks apart, energy level 6. He got 1,000 pulses each time. And this is pre-treatment. The first video is pre-treatment. And you can tell he is pretty owie. He is really having a hard time. Now this video, it's 48 hours after shockwave treatment. And you can see how much better he's moving. I mean, he's almost not even limping in that video. He's feeling so much better. Shockwave in review. Shockwave is basically a physics term for a high energy sound wave. It's characterized, like we said, by a rapid rise time, then followed by a slight cavitation dip, and a clearly defined focal area. And the size of that focal area is very important in our treatment protocols. Sound energy is released into the tissues and causes a physical stimulus to the cells. And this causes the cells to release their cytokines and growth factors that aid in healing. Different shockwave generators have different focal areas and require different treatment protocols. Shockwave has been proven to be safe and effective at treating tendon and ligament injuries, improving bone healing, and is part of a multimodal approach to osteoarthritis treatment and in treating chronic pain. And so in conclusion, owners want to provide a non-invasive advanced treatment to improve their pet's quality. More and more pet owners are coming in and not wanting to put their pets on a lot of different pain medications. And so this gives you the ability to provide something that will decrease their dependence on oral pain medications or even injectables. The ability is also to offer a clinically proven, safe, and sedation-free treatment for many difficult cases that will set your hospital apart from others. And that is it in conclusion. So we'll open it up for questions and answers.